So this is the last talk of this session. It's comparison of postoperative outcomes according to intravesical prostatic protrusion in patients with benign prostatic hyperplasia who underwent whole new laser enucleation of the prostate. Dr. Eun-San Yo.
Yeah, I'm sorry, Dr. Yu is at the ICS committee meeting, so I'll present instead. My name is Youngjin Seo. The last one is my name. I'll present about comparison of postoperative outcomes according to intravesical prostatic protrusion in patients with BPH who underwent whole lab. Intravesical prostatic protrusion is a useful factor for predicting clinical progression of BPH. We attempt to analyze whether IPP affect the postoperative outcomes of whole lab. Our study includes 94 patients who underwent whole lab. We checked perioperative IPP on TRUS, and follow-up is more than 6 months. The duration is from January 2012 to December 2015. IPP measured by transrectal ultrasonography. We divide the patient into 2 groups on the basis of degree of IPP. Insignificant IPP group is IPP less than 10 millimeter, and significant IPP group is IPP more than 10 millimeter. Surgical outcomes were analyzed at 3 months, and the late complications were analyzed at 6 months later whole lab. Patient characteristics and the surgical outcomes were retrospectively compared between the 2 groups. The table shows baseline patient characteristics between 2 groups. Patient characteristics were not significantly different between the 2 groups except for preoperative IPSS storage and QOL. Preoperative IPSS storage and QOL was significantly higher in the significant IPP group. Next table is shows clinical outcomes between 2 groups. Postoperative improvement in IPSS storage, voiding, QOL were higher in the significant IPP group. In conclusion, IPP is an independent factor for predicting postoperative outcomes in BPH patients who undergo whole lab. We can expect better postoperative outcomes in patients with significant IPP. Thank you.
Please.
Kai Tikkinen, thanks for your presentation. I personally have used this. I also, because of the Korean work and everything, I have been reading this and kind of a little bit believing that this IPP may make some kind of difference. However, now the question comes now. So, in your study, if you had IPP, you were more likely to have severe symptoms. And if you did not have IPP, you're more likely to have less severe symptoms. And when we have severe symptoms and we treat sick people, we are more likely to get treatment benefit than treating less sick people. Is it actually just that IPP people have more symptoms, and if you treat sick people, you're more likely to get more benefit than if you treat healthy people or healthier people?
Yeah, I think whole lab is both helpful with IPP or severe IPP or less IPP. Both of patients will get the benefit from whole lab. But usually, if a patient have a severe IPP, he has usually severe storage symptom, and after surgery, the treatment benefit is more high, I think. Both of patients have benefit.
Do you think you'd have had the same response if you'd performed a TURP on these 2 groups of patients? Is it the whole lab, or is it just the removal of tissue, as Carrie said, in patients who are more symptomatic, who therefore feel much better?
I think TRP is also good surgical treatment, but whole lab is better than TRP in terms of operation time, bleeding control. Usually, I think whole lab is the best merit of whole lab is get many tissue same time than TRP. I think it's a more efficient surgery than TRP.
It's not quicker, though, is it? I mean, you're suggesting perhaps it's quicker than TURP. It's not quicker when you add in the morcellation. I agree. It takes away more tissue.
Okay. If there's not any more question, I'd like to ask our last speaker. Thank you very much